A new report just out in the last hour on the dangers of our drinking habits in Canada. More than 1 million Canadians are treated each year for alcohol use disorder. Yet, a new report led by Canadian researchers says early screening in the doctor's office could go a long way towards saving lives. In a moment, I'll speak to the lead author of this report about how much alcohol consumption is truly safe. But first, Cass Rusey on how doctors can help keep people from hitting bottom.
I used to hate the smell, and I love the smell of tomato plants now.
It's a perfect late summer morning, and Jamie Game is exactly where he wants to be, tending to a garden bursting with vegetables and flowers. It's a welcome change from a life of addiction to alcohol and drugs. But that's all behind him now. The 57-year-old has been sober for 8 years.
Drinking was getting out of hand and stuff. And I went to my doctor because, you know, you respect and trust your doctor because he knows all. Doctors know all.
Game says he'd hit rock bottom, so during a medical appointment, he told his doctor he was worried about his drinking.
He's old school. He said, well, then just don't drink so much.
Routine screening for alcohol abuse should start in the doctor's office and early on. But in many cases, the disease goes untreated. In part, says the lead author in a new study, because of the stigma associated with the disease by both patient and physician.
There is a nice understanding. I don't tell, I don't ask. And even if I see certain things like smell or like outward signs, or if I happen to make a liver blood test, I don't talk about it.
He says stigma and lack of screening are the main reasons why alcohol use disorder is among the most untreated mental illnesses in the world.
Every patient I see, I do try to take some alcohol history on. I do my best.
This family doctor says talking about addiction is a two-way conversation.
I have to start thinking more preventatively. You know, I have to start identifying them before they get to be drinking that much.
In the end, Jamie Game's family doctor eventually did recommend treatment for his addiction, but only after Game says he insisted on it. Cass Rusey, CBC News, Toronto.
The report says doctors should regularly ask their patients about alcohol consumption and give brief lifestyle advice early on. But is it true most people don't tell their doctor the whole truth when it comes to alcohol? Tonight in the chair, we have the senior author of the CAMH-led seminar just published in the Lancet, Dr. Jürgen Rehm. Dr. Rehm is a senior scientist and a world-renowned addiction specialist at the Centre for Addiction and Mental Health here in Toronto. Dr. Rehm, good evening to you.
Good evening.
This report says the advice from a doctor should start as soon as someone says they consume 2 or more drinks a day. What ideally should a doctor say to the patient at that point?
At that point, the doctor should just say that this is more than the usual drinking guidelines would recommend and that they should cut down. Nothing more is required at that point. Just a little reminder that this is more than usual guidelines and more than the rest of the population.
What are the guidelines today?
The guidelines today are sex-specific, and they would say that at any given day you should try to be less than 2 drinks a day, and for a week less than 13 for men and less than 9 for women.
Okay. So is there a safe amount of alcohol? Are these guidelines telling us what it is safe to drink?
No, we no longer have safe drinking guidelines because no level of alcohol is safe. What you have, for example, if you're a female and if you drink only 1 glass of wine a day, you have an increased risk of breast cancer. However, at that level, this increased risk can be balanced off with a beneficial effect of alcohol on the heart. So 1 drink a day is not safe, but it's low risk, and that's why we call them low-risk drinking guidelines.
So for a woman who is drinking 1 glass of wine a day, how much of a risk, more of a risk for breast cancer does she have?
It's about 9%.
Wow. And then I imagine it goes exponentially up for people who are drinking 2 and 3?
It goes up exponentially, and of course, even more than 2 and 3, it goes up more and more exponentially.
Okay. Is it true that patients aren't honest with their doctors when it comes to how much they drink?
Well, sometimes they're not. Sometimes they're waiting for the doctor to ask, but the doctors often do not ask as well. So we're often in a situation where the patient doesn't really want to tell, the doctor doesn't really want to ask, so nothing happens and nothing is being asked.
Okay. Why is that?
Well, if you look into the different diseases and what kind of an image they have in the population, you see that alcohol or problems with alcohol are attached to a pretty severe stigma. That means you try to avoid this theme. And this is part of the reason why this situation exists.
Nobody wants to be labeled an alcoholic.
Absolutely. Our society is embracing alcohol. It is part of everyday life. It's part of most parties. It is part of celebrations. But if somebody has problems with alcohol, he or she is cast away. He's somebody different. We distance ourselves from those people, and that's part of the problem.
Okay, that brings me to this question. Is it alcohol that's addictive, or is it that some people have a problem with alcohol and they will not be able to handle it, but it's not the problem with the alcohol itself, if you understand what I'm trying to say?
It is an interaction. Obviously, part of it is hereditary. So it is not true that everybody has the same chance to become to get an alcohol use disorder. On the other hand, alcohol is a highly addictive substance. And alcohol, if you drink enough alcohol over a longer time, almost everybody would get addicted if it's enough.
Okay, so what's enough? So if let's say what you hear and what you see online. Say somebody comes home after work, they pour themselves a glass of wine, maybe they have another glass of wine or 2 with dinner and then 1 after dinner, and that becomes a regular habit, let's say 5 days a week. Is that alcohol use disorder?
Alcohol use disorder is defined by the inability to control alcohol consumption. That is the official medical definition. And in those people who drink 4 or 5 drinks 5 times a day, not 5 times a day, but 5 times a week,
right,
there is a chance that those people actually become addicted, that they lose control. One of the signs of losing control is that they drink more and more, that it used to be 3, becomes 4, 5, 6 drinks, a bottle of wine, etc.
Okay, and as a society, are we drinking more today than we did, let's say, 5 years ago?
We drink more today than we drank 5 years ago, yes.
Okay.
And we drink way more than the average of the world. And yes.
Really?
Yes, really. Yeah. I mean, in the world, more than 50% are abstainers. Lifetime abstainers of the adults.
And in Canada?
In Canada, it's less than 20%.
Okay. Why are a lot of people so afraid to give up alcohol? People who would never call themselves alcoholics, who hold down jobs, who have kids, who are fun, but yet they can't go on a vacation, can't imagine going out with friends without holding a drink.
It is part of our social fabric. Alcohol, because it's so much intertwined with daily life, has become part of a ritual, has become part of our feeling okay. And so it's associated with all those good moments, with social interactions, etc. And because of that, it is hard to cut down, and it is easy, or it can happen that it is increasing, and suddenly you realize that you have lost control.
Okay. If you feel like you've lost control, what help is there for you?
The easiest should be the family physician. And a family physician should ask anyway about your consumption. He is able or she is able to judge whether you have lost control, and they can initiate interventions, including medication.
Okay, what kind of medication can help you get off the booze?
There are 3 or 4 medications which are approved for Canada, and they work mainly on the internal reward system, and they can be used even, one of them can be used even that you take the medication before you believe that you may drink too much, and that helps you control.
Okay. What's your impression? How would you characterize, before I let you go, how would you characterize the manner, the societal view of alcohol in this country? Do you think that it's a danger?
I think Canadians are schizophrenic about alcohol, and alcohol right now plays a huge role. We should not forget that Canada right now is stagnating in life expectancy, slowly going down. Alcohol does play a huge role there. It is responsible for a lot of emergency visits. It is responsible for increases in liver disease, hospitalizations, and a lot of those signs are warning signs, yet our society is completely disregarding those warning signs for alcohol.
All right. Well, we'll leave it on that note. Dr. Jürgen Rehm, senior author of the report and a senior scientist at Institute for Mental Health and Policy Research at the Centre for Addiction and Mental Health in Toronto. Thank you for joining us this evening.
Thanks for having me.